Okay, first step we're gonna do is paint the tray, the custom tray, with the adhesive so that the impression material will stick to the tray and there will be no deformation of the material as you pull the impression out of the patient's mouth. Okay, so you're gonna grab a little bit of the adhesive and you're gonna place it on top or inside the tray. Sometimes the little cap comes with a little brush sticking out from here. Remember, since this has already been in the mouth, because we tried it in the patient mouth, it's already contaminated, so you don't want to use the little brush, because if not you will contaminate the whole bottle. Okay, now that you have the adhesive inside the tray, you're gonna spread it out to make sure that all the tray is covered by the adhesive on the intaglio. Okay, you want to have a small layer so that it dries faster. Okay, extend it all the way to the borders of the tray. Good. Alright guys, so before we do the impression, we want to Vaseline the Denoform. This will be only for this procedure on a real patient. You don't have to Vaseline the patient, but if we don't do that, it's gonna be very difficult to remove the tray from the Denoform. So what we're gonna do is we're gonna grab a little bit of Vaseline, and with some gloves you're gonna spread that Vaseline throughout the gingiva. Let's make sure that there's no Vaseline on the teeth that we are impressing, because adding a layer of a material then we will get an inaccurate impression of the prepared teeth. So very gently we come. If it touches the other teeth that you're not preparing, is not as critical, but what is really critical is the prepared teeth that we're impressing. Okay, now that we're ready to make the impression, we're gonna place the Denoform on the mannequin and have the patient ready for the impression. Okay, on the other side, you're gonna receive a small syringe with extra light impression material. You're gonna receive it this way, where it is locked here on the tip so the material doesn't come out. It is very important to turn it so that it's completely straight. If it's just a little before completely straight, the material will not mix well and you will make a mess. So let's make sure that it's completely straight. Okay, by this time the adhesive has already been dried. Usually we want to give it around 5 to 10 minutes. Make sure that it's completely dry. We can use the air water syringe to help dry the adhesive, and that's another reason we want a thin layer. If it's very thick, then it will take longer to dry. Okay, so now we're gonna come to the patient and we want to be sitting down. We want to be comfortable, in a comfortable position. Okay, we want to place the patient on the position that you can access the preps the best way, which in this case, since we're working in number 19 and 20, we're gonna ask the patient to rotate their head towards the right, so we have a better view of the prepared teeth. Okay, so what we're gonna do is we're gonna start squirting the material, starting on the margin, and we're gonna make sure that we capture the margin first and we continue going occlusally without removing the tip all the way to the occlusal surface and covering the whole tooth with the impression material. If we remove the tip and come back, we will create a bubble, and then the impression will not be as good. So we are gonna start on the margins, go around and going up on the axial walls until we get the occlusal surface, and then when we finish there, we continue to the next tooth the same way, and when we finish both teeth, if we have extra material, we can squirt it on the occlusal surfaces of the other posterior teeth to have a better accurate impression. Okay, so we are gonna make sure that we communicate with our assistant, because once we start mixing this material, the assistant needs, or your partner needs to start mixing the tray material, and they will set at the same time. Okay, so now when we're ready, we communicate with the assistant, and okay, we're ready for the impression. Okay, we're gonna show you how the tray should look after being filled up. Okay, on the meantime, I will start mixing the material. We always want to what we call bleed the material. Just put a little bit on your glove and then start, as I mentioned, on the margin without removing the tip, then the axial walls until you get to the occlusal surface and you cover the tooth completely. Once you got that, you continue to the next tooth. Now that we have covered completely both teeth, we have some extra material. We can place it on the occlusal surfaces of the posterior teeth. Okay, now we're gonna take a look here at the tray, and we want this to be filled up to the borders of the tray. And now we'll just sit the tray by holding the tray firmly on both sides. We don't want to press only one side, both sides at the same time, and we're gonna sit the tray completely until the tray sits on the teeth, on those stops, tissue stops that you created on the custom tray. During this procedure, you want to hold the tray in position. On a real patient, the patient will be moving their tongue, they will be swallowing their saliva, and the tray might move. We don't want to have any movement. If not, the material will deform, we can create bubbles. So at the whole time, we want to hold it there. This material takes 5 minutes to set. So for 5 minutes, you're gonna time it and hold it there. And in a minute, I will explain you how to remove the tray from the Denoform. Alright guys, the last step will be to remove the impression from the Denoform. Usually on a patient, it's gonna be easier to remove. What I prefer doing is breaking the seal on either side of the tray of the impression. Once you break the seal, air goes inside the tray, it will be easier to pop out. Now on this Denoform, it's gonna be a little bit more difficult, so we will need a buffalo knife, and what we want to do is try to fit the buffalo knife between the Denoform and the tray, and try to wedge it out very slowly. You go on different areas of the tray. Let's try not to stick the buffalo knife around the two teeth that we impress, because it might affect the impression. So I usually start on the back, and you are gonna stick it a little bit, and then you're gonna turn it to wedge that impression out. As you can see, it's coming loose on both sides. Okay, you might hear some cracking there. See, now we have a little bit of space and we can start. Okay, so now I think we can pull this out. You start pulling from all directions. And then you get the impression. All right.